Hi, and welcome back. So, today we're talking about supplements and questioning the need of supplements. For any new people, my name is Tamika. I'm a nurse practitioner and holistic health and wellness coach, and I help people reverse chronic disease and achieve healthy, sustainable weight loss through holistic diet and lifestyle changes. So, thank you for joining or listening, and please feel free to comment, share, like, and follow my page if you are looking for some holistic recommendations to help improve your health. So, thank you for any new people. I am open to any questions. I'll do my best to answer your questions. But until you have questions, I'll just talk about my topic for today, which is supplements. And I find that, I'm a practicing nurse practitioner. I work in gastroenterology and I see a lot of patients, and I hear a lot about supplements, and people are literally drowning themselves in various supplements. And when I ask about the point of taking some of these supplements, some people don't even know why they're taking them. They just heard that they were good for this thing and that thing, so they started taking supplements. And people, unfortunately, don't really weigh the risk versus the benefits of taking supplements. So I'll be on here roughly a half hour or so just talking about supplements. Please feel free to chime in if you have any questions or comments or suggestions. So, some of the things to consider with supplements, if you think about the term supplement, right? Supplement should be supplementing uh, uh, your healthy diet. So, oftentimes people still have a very poor diet, heavy in processed foods, and then they're looking for supplements. What supplement can I take to help with this disease, that disease, or this symptom or that symptom? And they continue to consume a lot of processed foods, a lot of junk foods, and low quality food items. And if you're going to invest your money in anything, the first thing should be improving the quality of your food. Thank you for any new people. My name is Tamika. I'm a nurse practitioner and holistic health and wellness coach. So, hi. Oh, yeah, Tattooed Kisses. Thank you for joining. I remember you. So, thank you. And please like and comment and share and do whatever else might help. So, thank you for coming on here and listening. So, let's see, what's my camera doing? So the question is, uh, supplements. Do you really need that supplement? First and foremost, you should be focusing on improving the quality of your diet. If you don't have a diet that consists of meat, eggs, fruits, and vegetables 80 to 90% of the time, honestly, you have no business looking into supplements. Supplements are going to be of very little benefit if your diet is poor. No amount of supplements can make up for a poor diet. And if anything, those supplements will be adding to the burden of your liver and various other organs, in addition to your poor diet. So, if anything, it could be detrimental to add on more supplements when you still have a poor diet. So, the first thing is improving your diet to more whole foods and consuming whole foods a majority of the time, and that will give you a majority of the nutrients you need. So I just want to say that that's the baseline. But let's say you are on mostly whole foods diet, and you think that you could benefit from some supplements. So what are some things you should consider? Well, a lot of times when people purchase supplements from, let's say, their local grocery store or somewhere like Walmart or some of these big box stores and things like that, those supplements are not going to be of good quality. They are often sitting on the shelves for a long time. They have poor quality control, and they have a lot of additional inactive ingredients. I talk about this in my book, 10 Simple Steps to Health and Wellness, a Nurse Practitioner's Guide to Reclaiming Your Health. A link is in my bio for the book. But people, Oh, I see my girl on. So supplements, people often turn to these supplements and think that they are somehow making up for their unhealthy diet, and that's generally not the case. So like I said, the first thing is making sure you are hey, what's up, making sure you are consuming whole foods as much as possible. Meat, eggs, fruits, and vegetables should be a majority of your diet. So let's say you have that part under control and now you're bringing in supplements. You should be very picky and choosy with where you're getting. Oh, hello, Victory Paradise. Oh, Elohim. Yes. Hello, and thanks for joining. Thanks, all you guys, for joining. So the quality of your supplements matter. And so let's say you decide that you need a particular supplement, maybe a vitamin D, or maybe I don't know, magnesium or something like that. And certainly you could benefit from that. Many people, most people are vitamin D deficient. And magnesium, unfortunately, because the soils are depleted, a lot of our fruits and vegetables and food aren't as rich in magnesium as they once were. So let's say you could benefit from a magnesium supplement. Most people could. The quality of your supplement matters, because when you're buying your supplements from these local places, or maybe you found just a random one on Amazon and you're buying these supplements, they are often very poor quality. They have low quality control, and they have a lot of excipients or inactive ingredients. These additional ingredients that they label as inactive, don't let that fool you. A lot of people react to those additional ingredients, and these are the stabilizers, the artificial colors, the artificial flavorings, sweeteners, even. And so these are preservatives and things like that, that they make it seem like, don't worry about those additional ingredients, they're not a big deal, you're going to be fine, taking this supplement. And there actually have been studies to show that people have suffered severe side effects from taking supplements because of even the inactive ingredient. It wasn't even the active ingredient in the supplement. Sometimes it's the inactive ingredients that can really have a negative effect on you. So when you're looking at your supplements, you want to be very judicious with choosing your supplements and the quality of your supplements. If you really believe that you could benefit from a supplement, you should be doing research to find out what is the best quality that you can afford, and aim for that. You should be looking at the sourcing and the processing of that supplement, and how much additional inactive ingredients are present. That should be at a very minimum. You want to minimize the inactive ingredients, because that will reduce the chances of you reacting or having some negative effects from those supplements. So those are things to consider when you're looking at your supplements. And you once again, guys, if you have any questions, please feel free to drop them. I'll do my best to answer. I can't guarantee I can answer everything, but I'll do my best to help you. So you have to think about some of those inactive ingredients. And when people take supplements and they think that the supplement is helping them, they're on supplements for a long time, and then they are like, oh yeah, I've been using this supplement, and now they come in with symptoms. They never make a connection to the supplements that they're taking. They may have some gut symptoms like nausea or indigestion, upset stomach, diarrhea, constipation, things like that. They may have these symptoms and they never make the connection to their supplements because they've been on these supplements forever. I've been taking these forever. That is actually a problem. You should never just take a supplement indefinitely, because you don't know if you're having any sort of negative effects from that supplement. So I periodically go on a supplement holiday. I will rotate through any supplements that I'm taking to see how do I feel off of this supplement. You might be surprised that you may stop the supplement and find that you feel better off of it. The only way to know is to stop it. If you keep taking it long term, how are you going to know if it's helping you or hurting you? So, periodically stopping a supplement is a great test to figure out if it's being beneficial or harmful to you. So, you might want to experiment with that. And then the supplement that you're taking, and when you stop it temporarily and see how you do, it helps you to evaluate how you respond not only to the supplement, the active ingredient, let's say magnesium or whatever, but also the inactive ingredients. You should be taking note of what kind of inactive ingredients are in your supplement. And if you find that when you stop that supplement, you're feeling better, you need to pay attention to those inactive ingredients in addition to the active ingredients, and write it down so you can refer back to that in the future. If you take another supplement that has the same inactive ingredient and you're feeling poorly, well, there you go. There's a good chance you may be intolerant to that preservative, that binder, that, whatever, artificial color or whatever the case may be. So you might want to, experiment with that. So that's one thing to consider. The other thing is, once again, long-term effects. You know, are these supplements truly benefiting you, or is that formulation beneficial to you? Magnesium is notorious for that. There's so many different formulations of magnesium. You may be taking magnesium gluconate, and it's like, well, I don't know, I thought it was helping, but when I stop it or when I switch to magnesium glycinate or bisglycinate, that was really helping with my muscle cramps or my anxiety, or it was helping me sleep better at night, whatever. The point is that even rotating through different formulations of your supplement, or when I take magnesium orally, it's not helpful, but when I use it topically, I'm having a good effect from it. Once again, those are some things that you have to experiment with. And the only way to find out if that's going to be the case is to stop your supplement temporarily and maybe try a different formulation and see how you feel on something different. So, those are some things to consider. And then, even looking at the beneficial side, if you find that when you stop this supplement, you are really dragging and you feel terrible, you should be asking yourself, why? What am I missing in my diet or other aspects of my lifestyle that's making me so deficient that I need this particular supplement? So, you could always bring your supplement back, but this is an opportunity to investigate for other causes of things that could be interfering with your quality of life and your overall health and wellness. So, rotating through your supplements can be beneficial in a variety of ways. As I alluded to earlier, various supplements can have negative effects on your liver. Your liver generally, sorry, has to process all of these things, right? So what you should be asking yourself is it worth it to give my liver more work with this supplement? Am I getting that much more benefit with this supplement that I should burden my liver to help manage this additional technically it's a medication, right? Because if it's having some physiologic effect, then you know am I is it worth it to give my liver more work to process this particular supplement? Am I getting that much benefit? So you should always be considering this when you're adding on a supplement. Is it worth it to give my liver more work with this particular supplement? Once again, for any new people, thank you for getting on. I'm going on 15 minutes now. My name is Tamika. I'm a nurse practitioner and holistic health and wellness coach. Feel free to comment if you have any comments or questions or whatever. Just drop them in there, and like and follow and share and do whatever would be helpful for the live. I appreciate you guys joining. Thanks for getting on. And so we're talking about supplements today. I help people reverse chronic diseases and achieve healthy, sustainable weight loss through holistic diet lifestyle practices. And oh, it looks like I'm getting a little bit glitchy, but sorry, my there you go. So, making simple dietary changes can have a big impact on your health, and a lot of times will help to reduce the need of supplements. So, if you have a poor diet, a nutrient poor diet, you eat very processed foods, you're consuming a lot of seed oils like corn oil, canola oil, soybean oil, and such, which causes a lot of inflammation and free radicals and things like that in the body. If your diet is heavily processed foods, like pastas and cereals and breads and a lot of takeouts, a lot of processed foods, cookies, cake, and things like that, all the usual junk food and chips and things like that. If that is a majority of your diet, you need to focus on your diet first. You should not be pursuing any sort of supplements because they're not going to have as big of an impact as you think with that kind of diet. When you get to the supplement phase is after you've mastered improving your diet, and that is whole foods, meat, eggs, fruits, and vegetables 80 to 90% of the time. That should be your diet. Solid advice. Oh, thank you. Yes, yeah, that's my partner. That is a professional there that's commenting on me. So I appreciate that, and I'm humbled by your presence. So thank you for commenting. I appreciate that. But if you're eating junk food, adding supplements, that's like, you know, you're literally wasting your money. You're better off spending your money on buying more meat, eggs, fruits, and vegetables. That is where you're going to get a majority of your micronutrients, your vitamins, your minerals, and your enzymes, are all the things that are going to support your health. So that should be your primary focus. Once you've mastered that and you decide, okay, I'm going to bring some particular supplements in, maybe vitamin D, maybe magnesium, or if you find some whole food supplements. I've supplemented with colostrum, I've supplemented with bee bread, which is like all the bee pollen and with the honey and things like that. And those are very nutrient dense supplements, and they can be very beneficial. But once again, it's because I eat whole foods a majority of the time. That's when I bring that in. And then to help me get to my protein goals, because if you follow me at all, you know that I'm big on protein. Getting enough protein is very important for your health. And the goal should be 1 gram per pound of ideal body weight. And so I'll do essential amino acids. But once again, the essential amino acids that I use have minimal additive ingredients. It's literally the amino acids. I don't use the powder version because it has, different flavors. I just use the tablets, and it's literally the amino acids within the tablet. So I'm very selective with my supplements, and I rotate through those supplements. I give my liver a break from having to deal with those supplements, even if they're beneficial, and it helps me to see how I feel when I'm off of those supplements. And then when I do choose a supplement, minimal additives, minimal excipients, and inactive ingredients as possible. And that should be your goal. And once again, you should be asking yourself on a regular basis, do I need this supplement? How long have I been on this supplement? Is it time to take a short break and see how I feel off of it? And you should be doing that periodically to help you recognize if you would benefit from stopping it, or help you recognize deficiencies in other areas of your life that you should be working on if you are really needing this supplement. So those were just some general recommendations on supplements. I thought I would mention that. I haven't done a video in a couple of days, honestly, but I thought I would come on and talk about supplements because once again, I'm a practicing provider. I'm a nurse practitioner. I'm seeing patients in clinic a majority of the week, and I hear a lot about supplements. I see, once again, I work in gastroenterology, elevated liver enzymes all the time, and they come in on various herbal supplements or other kinds of supplements, or they come in with all sorts of symptoms. I'm bloated, I'm nauseous, I'm constipated, and things like that. And they're, taking various supplements. It could be even protein shakes. It could be protein shakes. Thank you, Deborah Smith. I appreciate the compliment, and I appreciate the support. Thank you so much. So any of those things, you could stop and see how you do off of those things. And people are literally on supplements just like their medications. And don't get me wrong, I'm not here telling anybody to stop their medicines haphazardly. Can you eventually get off medication with healthy diet and lifestyle changes? There's a good chance you can, but you want to do that strategically. What are the 3 top supplements that you see elevated liver enzymes? Thank you. Good question. Well, what I will say is often herbal supplements, and it can be a variety of herbal supplements, things like ashwagandha, St. John's wort, some of those herbal supplements. And herbal supplements are a touchy subject. And that's because you don't know who's going to respond in what way. And I don't want to make it seem like I'm anti-supplement. I'm not trying to say that. What I'm saying is don't buy cheap supplements. Don't be cheap when it comes to supplements. If you're at the point where you need a supplement, that means you're ready to invest good money, do your research and buy good supplements. Okay, let me just clarify that. But the herbal supplements, let me tell you something that I've heard from a hepatologist, which is a liver specialist. He actually works at a transplant. He's at a liver transplant facility. And he came and visited our office and kind of gave us a little bit of a lecture about liver failure. And he said up to 60 patients per month are being listed for transplant, for liver transplant, because of herbal supplements. Let that sink in. I don't know if he was exaggerating, but that is astronomical. And so when you're taking a liver supplement, exactly, I knew you would appreciate that. When you're taking a liver supplement, a herbal supplement, you have to ask yourself, is this worth it? I could potentially put myself into liver failure with this supplement. And once again, I'm not anti supplement. What I'm saying is, don't be haphazard with supplement use. So it is generally herbal supplements that can really be harmful for the liver if you're not, and you don't know. Even if you're mindful and you're like, oh, I'm going to invest in this great supplement, you don't know about, your genetic predispositions that would put you at higher risk for having some negative or adverse effects of your liver because of using those supplements. So you need to be mindful and don't, people buy these concoctions and it's like all of these variety of proprietary blends even. It could be one supplement, but it has like 10 different herbs in it. And so if you start having problems, which herb are you responding to negatively? Which herb are you responding to positively? And so that is a problem, is when you buy these proprietary blends and you don't even know how you're going to respond to those things. So even that is another tactic that you might want to implement, is if you're going to start a supplement, do it singular supplements. You take one supplement at a time, and you maybe, I don't know, take it for a couple of weeks and see how you do it. And if you feel fine and you want to bring in another one, if you really need that, then you bring in a second or third supplement. Or if you take that supplement for a time and then you take a break from that and you try something else, might be how you want to do that. But honestly, in regards to herbal supplements, I think it's the entire category that we find is some of the biggest risk factors with elevated liver enzymes. When I see a patient that's referred for elevated liver enzymes, that's one of the main questions, in addition to, IV drug use, alcohol intake, is, are you taking any supplements in addition to excess Tylenol use or ibuprofen use? Are you taking any herbal supplements? So it's herbal supplements as a whole can be a potential issue for people, and you don't know who's going to respond in what way. So these are things you need to take into consideration when you are bringing in these supplements. Really ask yourself, is it worth it to put my liver at risk with these supplements? And that brings me to another important factor in regards to herbal supplements that I tell people. I have people say, oh, even today, that they were taking a Ceylon cinnamon supplement. I said, what? Why are you taking a supplement? You buy the herb, and you could buy cinnamon and you put it on in your food. Sprinkle some cinnamon in your yogurt, and or your cottage cheese or whatever. Use cinnamon in your food. Why are you taking a supplement? Or people take turmeric supplements. And turmeric is a great anti-inflammatory. It can be helpful with joint pain, and there's some evidence that turmeric can be good for the liver and such. But they take turmeric supplement. Now, this is the thing you have to consider when you're taking a supplement. You are at the mercy of that supplement company. Granted, you're at the mercy of every company when you buy anything, right? But the concentration of that supplement can be problematic. Generally speaking, when you're cooking with an herb, you are unlikely to overdose on that herb. Okay. So I put turmeric in all of my food. Almost, well, anything that's not sweet, I will put turmeric in. And that's it. That's how I get my turmeric supplement, through cooking. So things like garlic. Do you need a garlic supplement? Do you need fish oil supplement? Eat fish, eat fatty fish, cook with garlic, or even you could cut up fresh raw garlic and just put on your food at the end of cooking, so that the garlic is still very potent. So rather than taking a supplement, figure out how can you get that food, or get that herb or nutrient or whatever you're trying to get, through a natural source in your food. That's what you should be trying to implement. And it is unlikely that you're going to overdose or have some negative effects through with, if you're cooking with that thing. So that's another thing that I recommend for people when they're on a variety of supplements. I say, well, why don't you try cooking with that thing? And that reduces the risk that it will pose to your liver. So that's another thing that you might want to consider. Let's see how we're doing on time. 26 minutes. All right, we're getting towards the end, but I think this is a good conversation. Thank you so much, you guys, for joining. And so, once again, to recap, we were talking about supplements today. I'm not anti-supplement. I am anti poor quality supplement. Focus more on what you're eating versus the supplements you're taking. Amen. That's exactly the perfect summary from my PA colleague. That's a perfect summary for today's message. Focus on what you're eating, because whatever you're trying to supplement with, there's a good chance you will get it in your food. Okay, eliminate processed foods as much as possible. Focus on meat, eggs, fruits, and vegetables. High quality dairy if you tolerate dairy, and that's fine too. But that is where you will get a majority of your nutrients. After you have mastered that, you're doing that 80 to 90% of the time. You're hitting your protein goals of 1 gram per pound of ideal body weight. Then you start looking at supplements, and you need to really have a good answer. If somebody's asking you, why are you taking this supplement, you need to have a good understanding of why you're putting your liver and the rest of your body at risk potentially by adding on this supplement. Before you add a pill supplement, you should be asking yourself, is there a way that I can increase my dietary intake of this thing through cooking or eating more particular foods that are rich in this micronutrient? And then if you're still struggling there, then you bring the supplement. And when you bring in the supplement, it is a go big or go home kind of approach. There's no, cheap supplements from Walmart. Okay. If that is what you're buying, you are better off not taking any supplement. If that is your source of magnesium, you're better off being magnesium deficient. There, I said it. Okay. No poor quality supplements, because they are more likely to cause harm than good. Okay. So when it gets to the point where you're like, yes, I need a supplement, magnesium, vitamin D, whatever the case may be, you want to do something that's liver support or whatever, you need to be researching the crap out of these companies, and you should be narrowing down the supplements to a supplement that has a minimal additive ingredients, minimal excipients, which are the inactive ingredients in addition to whatever the active ingredient is. These are the stabilizers and the preservatives and the artificial flavorings and things like that. Minimal, because even though they're labeled inactive, it doesn't mean that you won't potentially have a negative effect taking that supplement. So there's that. And so once again, good quality supplements, fully research the companies, minimal additive ingredients. And that is going to cost more money, but it will be worth that more money. And then lastly is rotate through the supplements. Do not start a supplement and take it indefinitely, even if it is something like magnesium or vitamin D that most people are low in. You should periodically stop your supplements and see how you feel off of it. You might be surprised. The supplement, the very thing that you thought was helping you, could be making you feel worse, could be causing gut symptoms, headaches, poor sleep, things like that. Stop your supplements periodically. I would say even every 3 months or so. Stop a supplement and see how you feel off of it. If you feel significantly worse off of it, this is also an opportunity for you to take a look at your diet and lifestyle to find out, why am I so deficient in this thing? What other changes can I make to improve my situation so I'm not so dependent on this supplement? So, those are my recommendations for today's live. I hope that this was helpful for you guys. Please click the link in my bio if you want to check out my website, if you want to join my Patreon and be around people, like minded people who have the same goals as you, trying to reverse chronic disease or symptoms and achieve healthy weight. Or you'll also be able to get a link for my book, 10 Simple Steps to Health and Wellness, a Nurse Practitioner's Guide to Reclaiming Your Health. And it talks about all the things that I had to deal with to improve my health after I ruined it pursuing diet and unhealthy lifestyle practices. So if you want to get a little more guidance on things you could do to improve your health, go check out that book. I think you'll find it helpful. So thank you so much. I hope you guys enjoy the rest of your Friday, and yeah, take care. Consider those supplements. Go and check out your medicine cabinet and look at the kind of supplements that you're dealing with and see which ones you could throw out. Take care. Thanks. Thanks, Lou.